Hey traveler, my name is Brittany Gemwa. I am an occupational therapist and soon-to-be medical student. I volunteered with Kalan Kuxtal, a non-profit Guatemalan organization, and served alongside physicians by providing free primary care mobile clinics and home visits. The care we provided focused on prevention, intervention, education, and lifestyle or medication management as we partnered with local entities such as fire stations, community centers, and schools to transform hundreds of lives. I created this video to give you an inside peek into my time in Guatemala with Kalan Kuxtal. Some of my mentions may be ramblings and other tidbits might be helpful. Either way, I hope it helps you feel more confident about traveling abroad and volunteering with Kalan Kuxtal. I learned about Kalan Kuxtal during the pandemic. At that point, Kalan was a new nonprofit organization with a mission to partner with volunteers to bring medical care to rural communities. I chose Kalan Kuxtal because I preferred their approach to helping others while also educating volunteers and conducting research. The biggest challenge before going was the payment system. Kalan Kuxtal uses a third party to process payments. This third party, as a security measure, limits how much you can pay during one transaction. I was able to pay in full within 10 minutes, but it took me 5 separate payments. Now, I have been on 2 trips with Kalan Kuxtal, and this was the payment process both times. When I went in May, I packed 3 sets of scrubs and tops, 2 regular outfits, workout clothes, tennis shoes, a light jacket, hat, sunscreen, and basic toiletries. When I went in January, I added a medium weight jacket, gloves, and a hat as the mornings were chilly to me. Prior to leaving, I coordinated with the other volunteers to bring items such as candies, medical supplies, clothing donations, etc. I did not bring anti-malarial pills or need bug cream as the areas we went to were not risk areas. Using my bank card, I exchanged money when I got to Guatemala, but most places took credit card. Breakfast at our hotel was consistently delicious and varied with an array of fruits, juices, breads, and proteins. Lunches were balanced, filling, and made to perfection by a local chef. Each lunch was a party for my taste buds. For dinner, we always ventured to a restaurant in Antigua. My personal favorite is the Al Pastor Pizza at Vice. We ate so well. During clinic days, speaking in both English and Spanish and with an interpreter, I collected patient intake information, performed assessments and exams, tested for diabetes, and collaborated on a diabetes research project focused on daily risk evaluations. Beyond these tasks, I immersed myself in the culture and learned more from the Guatemalan people than I could have ever imagined. 4 clear takeaways from volunteering with Kalan Kuxtal include: 1. Through medical lectures and hands-on exposure, I expanded my knowledge and application about diabetes, hypertension, pharmacology, infectious diseases, pregnancy complication, vector-borne illness, and respiratory illnesses. 2. We conducted home visits for socially neglected populations. I found that being welcomed into people's homes lets you view how their medical diagnoses interact with living conditions, occupations, and quality of life. This opportunity to serve within their home led to an important palliative care conversation that would have been missed had we stayed in the clinic. 3. We walked the neighborhoods assessing people's risk for diabetes, taking glucose tests, and educating families about their next steps. Many individuals had uncontrolled diabetes and misunderstandings about basic health strategies. Small actions can lead to big changes, and in the long term, starting good health habits can help them focus on affording basic life necessities, such as water and electricity. 4. Kalan Kuxtal organized a cultural day that included going to local businesses to learn more about how they support the people of Guatemala. For example, Valhalla Macadamia Farm's main goal is to help communities gain access to income, employment, and improved well-being by donating macadamia trees to families to grow and then sell macadamia products. Each patient made a lasting impact on me, both personally and professionally. I encourage everyone to please join me in serving the underserved by volunteering. Regardless of your background, Kalan Kuxtal can use you to help others. You have skills that we want and need.